Good day, everyone. I'm Sarah Gordon, the Chief Market Development Officer at the Financial Health Network. I'm so pleased to be joined by Dr. Bechara Choucair, Senior Vice President and Chief Health Officer at Kaiser Permanente. Dr. Choucair was named by Modern Healthcare as one of the 50 most influential health executives and a top 25 innovator in healthcare. He's the author of a new book, Precision Community Health: 4 Innovations for Wellbeing. And I'm a particularly big fan of his, given I lived in Chicago while he was the commissioner of the Chicago Department of Public Health. And I watched up close all of the great things he did for our city, particularly for our most vulnerable residents. For those of you who are watching, as you listen, please add your questions to the chat on the Emerge Live page. We will be monitoring and we'll do our best to address them toward the end of our session today. Dr. Choucair, I'm going to call you Bechara, if that's okay. Welcome to Emerge Live. Thank you so much for being with us today.
Thank you, Sarah, for having me join this conversation. I'm so excited being here. It's an honor.
Excellent. So you've worked in healthcare and public health your entire career. First as I believe, family physician, and then later as an administrator. I'm curious what drew you to healthcare initially?
Sure. So thank you, Sarah, for the question. I grew up in Lebanon in the midst of a civil war, and I always had this idea that if I become a doctor, I can really change the world by treating patients in my practice. And so when I immigrated to the United States, I trained in a healthcare for the homeless program in Houston, Texas, as part of the Baylor College of Medicine residency programs there. And very quickly, I realized in my training as a family medicine resident or in my practice in Chicago 3 years later, I've realized that when you're really working with people living in poverty, people experiencing homelessness, all what I've learned in medical school and residency is good, but it's not nearly enough to help people live the lives that they'd want to live. And I very quickly realized that to really support people to live the lives that they'd want to live, it's a lot more than just healthcare. It's also about housing. It's also about economic opportunity. It's about legal protections. So I had the opportunity to work for a human rights organization based in Chicago, did some work globally in post-conflict zones. And then I had the amazing opportunity to serve as the health commissioner for the city of Chicago and Rahm Emanuel's administration for about 5 years. And I got to see firsthand the important role that public health plays in advancing the health and well-being of people. And that's really what drew me in. That's what keeps me in.
That's excellent. And we are definitely going to get into those intersections and how health is about so much more than medicine and our healthcare system. So, you're now at Kaiser Permanente. And for our viewers who may be less familiar with the organization, could you please give us an overview of the org and your role in it?
Sure. So Kaiser Permanente is the largest integrated health system in the country. We have been in existence as an organization for about 75 years, and we have about 12.4 million Kaiser Permanente members who trust us with their care, trust us with their coverage every day across our footprint in the United States. And as an organization, we've had the same exact mission since we were born. So we're about improving the health and well-being of our members and improving the health and well-beings of the communities where our members live. And if you think about it, those are really truly go hand in hand. So there is no way we can improve the health and well-being of our communities if we don't really focus on the health and well-being of the 12.4 million Kaiser Permanente members that we work and engage with every day. And at the same time, there is no way we can optimize the health and well-being of our 12.4 million members if we're not investing deeply in the health and well-being of the communities where those members live. And when we do that, when we focus on the health and well-being of our communities, not only will we be lifting up the health and well-being of our 12.4 million members, but really all 68 million people who live in those communities. So as an organization, that's really what we think about day in and day out. You know, our 200,000 plus colleagues, our 23,000 physicians who are part of that group, we wake up every day thinking about what can we do to lift up the health and well-being of our members and our communities. And my role within the organization as the chief health officer is being that advocate that's constantly thinking about what else can we do? How can we improve the health and well-being of our members better, as well as the health and well-being of our communities? And so that work focuses anywhere from focusing on the million plus Medicaid members that we take care of, and more of the duly enrolled members in Medicaid and Medicare, to thinking about our work on the social needs of our 12.4 million members. How do we make sure we're meeting their food and security needs, their housing needs, their transportation needs, but also looks at the health and well-being of communities overall, which goes into the core of what we'll be talking about when it comes to financial health and others in our communities. And I also oversee our environmental health portfolio and environmental stewardship portfolio for the organization. So it's a pretty broad portfolio, really
big role, yeah.
on really the core concept or spirit, if you want, of health overall, total health for our members and our communities.
So as a healthcare provider, as an insurer, as someone who is so focused on the needs of the community, you've really been in the eye of the COVID-19 storm. And I'm curious what the past 3 months have been like for you and your organization.
Well, it's been definitely different than anything we've ever experienced as an organization. And honestly, the whole world has experienced. You look at, the last 100+ years, this is one of the most significant public health threat that the world is dealing with. And the reality is, what we know about pandemics, we've learned from previous pandemics. So for someone who served as health commissioner for 5 years, probably the one thing that kept me up at night during those 5 years is the possibility that we might have to deal with a pandemic. And, I dealt during my tenure in Chicago with H1N1, with the Ebola crisis, with all other issues, but really nothing at the scale of the pandemic that we're dealing with today. So as an organization, the moment we've started realizing that this pandemic is not just going to be contained only in Wuhan, it's going to come to the United States, we really need to start preparing. We've activated as an organization across every step of the way to try to see how can we do more to be able to support our members, support our communities. Very early on, we were really working very closely with local public health departments on containing the pandemic when it first hit our shores. We've engaged with local health departments, we've engaged with state health departments to see what can we do to support that effort to contain that pandemic when it first hits our shore. The reality is very quickly, we started seeing community spread, and we shifted into what we called a mitigation phase, where we had as an organization to step up and be ready for the significant increase of numbers of patients who are showing up in our emergency department, people with COVID-19 who needed to be hospitalized, people who needed to be in ICU, on ventilators. We had to step up and work very closely with our labor partner to make sure we have enough protective equipment to support our and really keep our labor, our employees and healthcare workers safe. We've worked with state and the federal government on ensuring that we have access to all what's needed to support the surge that we've seen back in March and April. And then we started seeing a decrease. So we started getting ready to go into this next phase of the pandemic, which is about suppressing the pandemic, getting back to doing the contact tracing, the testing, the isolation, the quarantine. And then now, unfortunately, as many of the social isolation measures have been lifted across our footprint, we're starting to see another increase in number of new cases, number of hospitalization, number of ICU bed utilization, which gives us a little bit of concern. So I think this pandemic is still, and we're still in the midst of the pandemic. I know we are, and we have to continue to double down on our efforts to keep protecting our members and our communities.
Yeah, you've certainly been incredibly busy, and we appreciate you taking the time for this conversation. But I think the pandemic really highlights the importance of so many of the issues that you've been working on your entire career. And I want to go to the book, right? Precision Community Health: 4 Innovations for Wellbeing. I just recently finished reading it. I loved it. It was incredibly well written and compelling, and it was a really fast read, I think, because of that. And I learned a lot, and I loved all the stories about Chicago. Without spoiling it for our audience, I would love for you to explain what you mean by precision community health and how you believe this approach will promote equity, right, and improve the lives of our most vulnerable community members. And if you'd like to talk about how this approach is especially important with COVID.
Thank you. And I have to tell you, Sarah, I never ever thought I would write a book. And then I immigrated to this country. I got to live in Chicago. Chicago became my home, got the honor to serve as health commissioner for this beautiful city. And so I changed my mind. And I think that at the core of what this book is about, it's really to say and be really clear that the community health, public health is really at an inflection point in our history as a country and as a world. And for us to be able to really be effective in creating better communities, better environments that are more suitable for people to live healthier lives, to be able to achieve their dreams and achieve their potentials and what they'd like to achieve, we have to be thinking beyond just what a healthcare system alone can offer. Healthcare is so critical, and yet it's just not enough. We have to be able to focus on communities that are most impacted, focused on people who are most disenfranchised, and think about the types of interventions that would support these folks with that equity lens, so we can lift up people who need the most support, so you can lift up the whole community. And that's what this book tells the stories of. How can we do that when it comes to policies? How can we do that when it comes to data? How can we do that when it comes to leveraging media and education in a way that's really effective and pushes the limit? And equally as important, how do we do that when we get into communities, build community coalitions in a way that lifts up the assets of those communities? So what that book does is tells the stories along those 4 pillars of how we can have a precision approach to lift up communities so that communities can achieve their potential. So that's what this book is about.
Yeah, and like I said, everyone who's watching needs to go read it, and we'll provide more info at the end.
Sarah, one other plug here is that actually all the proceeds from the book is going to support a network that's called the Big Cities Health Coalition. It's a not-for-profit organization that brings all the public health leaders from across the largest cities in the country to come together and really advance public health in this country. And as you can say, and you can tell, no time is better than this time to let our public health leaders lead. So I'm so honored that they accepted to take all the proceeds from the book.
That's wonderful. It's really great. And your point about how public health and health is so much greater than, again, just the practice of medicine or our healthcare system. We've come to a similar conclusion on the financial health side as well, right? That it is about high quality financial products and services and helping our financial service companies get in the business, right? See themselves as being in the business of promoting financial health but it's also a much broader system, and we're operating. People's lives are much more complex, and it's going to really require a multi-sector collaborative approach. But I do want to spend time on this intersection between health and financial health. The focus of this conference and my organization, the Financial Health Network, is financial health. And by that, we mean how individuals manage their finances day to day in a way that really helps people weather shocks and pursue the opportunities in their lives. And we see a lot of research that shows how health and financial health are interconnected. In our own US Financial Health Pulse, we found that those who are financially struggling are in poorer health, and those that are physically or mentally unhealthy report lower financial health, right? So it's this vicious cycle. And as we said, COVID-19 has really brought this intersection more into focus, that we're experiencing a public health crisis, but we're also seeing a severe financial health crisis. So I'd love for you to talk about how that intersection comes up for you in your work, and especially at Kaiser Permanente, where do you see examples of that intersection, and how are you working to address it?
Yeah, thank you for this great framing for this question that I totally agree with. And actually, I'm going to start the answer by reflecting on one of the very first patients I met when I started my residency training in Houston, Texas. We were at a shelter in Houston, and I just fully ready to talk to my patients, talk to them about the importance of colon cancer screening and all kind of other screenings. And I remember this one patient, we were sitting, it was a Wednesday night or something like that, and we're having the conversation with this person, and I was telling him about how important it is that now that he's over 50 to get a colonoscopy to screen for colon cancer. And I kept and he wasn't just interested at all. And I kept coming back to this topic. And then maybe 5 minutes down this conversation, he looked at me in the eye and he's like, dude, what is it you don't get? I'm not worried about potentially getting colon cancer 5 years from now or 10 years from now. What I'm worried about, do I have enough money in my pocket to get my food tomorrow and potentially be able to put a deposit on my rent so I can get into a place so I'm no longer sleeping at a shelter? And to me, the story is always front and center to my mind. And the more I progressed in my career, the more I've realized, and I've seen it head on, this connection between financial health and health overall. We know from surveys after surveys after surveys that there is a direct connection there. I mean, think about the top 1% earners in this country and the people who are in the bottom 1% of income in this country, and you look at their life expectancy, there's a 12-year difference. So if you're in the top 1% richest people in this country, you're expected to live 12 years longer on average than if you're in the bottom 1% of the income in this country. And we've seen that also in surveys. Just last year, we've administered a survey, and that's before COVID-19 hit. And what we've randomly selected a representative sample of people in this country, and 68% of these people have experienced at least one unmet social need in the prior year. And 1 in 4 people have experienced a social need that was a barrier to health. So we know from that survey that 21% of people living in this country had to prioritize buying food or paying rent over getting the health care that they need. So the connection there is crystal clear. We've also seen, when we've asked those folks that we've surveyed, and what we've realized is people with social needs are twice more likely to categorize their health as poor compared to those who don't have those social needs. So the reality of the connection is right there. It's so straight. There's no doubt about that. So as an organization, we've been thinking about what's our role to support our own members with their financial health, as well as what do we need to do within the communities to create better environments for financial health. And I'm happy to go into examples if you'd like me to do that. But that's the framing I think is so critical.
I absolutely want you to go there. And apparently so does our audience. We got a question saying, Kaiser member here, what specific initiatives are you looking into to improve your members' financial health? So I would love for you to speak about kind of on the business side and your support of members, but also those broader initiatives in the community as well.
Yeah. So let me take one, and we have, by the way, many examples. So let me start with one concrete examples on the member side, and then I'll give you one concrete example of our work in the communities, because I think those go hand in hand. In our surveys of our members and our engagement with our members, we've heard repetitively from many of our members that they are having financial challenges to even be able to buy the food that they need to be able to live healthier lives. I mean, just simple, just not have enough cash to buy food. And food insecurity becomes a significant issue that's directly tied to financial health. And so when we started engaging with our members, we started this process a few months back. And now in post-COVID, we're realizing how many of our members are facing even more financial strain. They're needing more support with access to healthy food. So we are partnered with a couple of organizations, and now we're engaging with our members and those members who qualify for food stamps, but they don't have it. So we're engaging now with those members in multiple ways, by text, by phones, by directly engaging and supporting them along the way. And we have already over 45,000 members who've completed applications to be able to sign up and get food stamps. And that's about, $150 to $170 per month extra that those members will get into their pocket to be able to spend in their local grocery store so that they can put at their dinner table. So that's one example of how we're thinking about that. On the community side, we've also realized that there is a big role we can play to support small businesses, particularly Black-owned or other minority-owned businesses, women-owned businesses, veteran-owned businesses, LGBT-owned businesses. So we've partnered with organizations, and we've hosted multiple cohorts across our footprint of literally over 1,000 of those small businesses over the last couple of years across all of our footprint, to support these cohorts with the right coaching, the right mentorship, the right business planning development, access to capital so that they can be able to grow their businesses. And we've seen these businesses grow significantly, adding more jobs, adding access, having more capital to do business, and being able to be of a size big enough to be able to do business with Kaiser Permanente, which as an anchor institution, we spend billions of dollars in doing business with organizations across the country. So by having those cohorts, we can really double down on our commitment to purchasing from minority-owned businesses, women-owned businesses, and we've done that to the tune of about $2 billion every year now. So those are two concrete examples of how we're engaged in this work.
And I've seen you present before, and I know sort of individual financial health building is increasingly on your radar. And I know it's, the primary topic that our audience is coming together to explore. Anything that you have in development or that you're thinking about, or how are you starting to view I think the small business piece is really critical from an economic opportunity, and we've done a lot of work around small business owners and how the business's financial health and the individual's financial health often gets conflated. But as you think about your members who are struggling to pay their bills, or who have limited savings or credit, right, that they need to rebuild, have you thought about how you might start to approach some of those challenges?
So a couple of things to keep in mind. One, we're actively looking, and we're not ready to announce yet, but we're actively looking into what type of products or services our members could benefit from when it comes to their own individual financial health. We're working on that. It's not ready. It's not ready yet, but we're realizing, to your point, quickly and more every day, that if we want to think about the health of our members overall, we can't just be thinking about their physical health or their mental health. We have to be thinking about their social health, and their financial health is an incredibly important aspect of their social health. We've heard that directly from our members. We know that from the research. So more to come on that front. At the same time, we also realize that many of our members have challenges being able to meet their copay, their deductibles, their their coinsurance, and so we have robust programming and planning within Kaiser Permanente, where we're offering literally hundreds of millions of dollars every year in medical financial assistance to members who we know are struggling with their financial health. So whether you are up to 350 or 400% of federal poverty level, we've put systems in place to be able to support you, whether you're our members or honestly, even if you're not our member, when you're accessing services through that system. So continuing to enhance our ability to support our members when it comes to affordability is critical. And now in the COVID pandemic is even more critical. That's why we've waived copays, we've waived testing costs, we've waived cost sharing from the overwhelming majority of care related to COVID as a result of this pandemic. So more to come on that. This is an emerging space that my team is spending lots of time and energy, and would love to keep you all posted as this continues to evolve.
Yeah, we're excited, and also to sort of be a partner in that, and I think our network here, right? We're all rooting for you to sort of figure out the best strategy and approach for your organization as it relates to individual financial health. I'd love for you to talk a little bit, and maybe it's self-explanatory, but how are you starting to think about the business case for some of these efforts, right? That really kind of get at improving financial health security, economic opportunity in your communities. Is this, is it really of critical business importance? Is it really the clinical importance, or is it really moral importance, right? As it ties to your mission as an organization, or maybe all of the above?
Yeah, it honestly is all of the above, Sarah. I think when you look at the financial health overall and you start carving out the components that are even more closely related to total cost of care and outcomes, part of the reason why we're spending so much time on food insecurity, which is, you're food insecure because you don't have enough money to be able to buy food. I mean, it really is directly connected to your financial health. Part of why we're spending so much time and energy there is because the business case is a lot clearer there. We know that if you're food insecure, your chances of being of your total cost of care is higher than if you're food secure. So it just makes total sense for us to be actively engaged with you to make sure that we're addressing your food insecurity issues. We know that if you don't have enough money to buy food and you're a pregnant woman, chances are you're going to go and get into preterm birth or have a low birth weight baby. And we know that's directly tied to your total cost of care. We know if you're hospitalized and you're being discharged from the hospital and you can't afford the food that you need after you're being discharged, chances are you're going to be readmitted to the hospital are 50% higher than if you have the money you need to be able to buy your food. So it becomes a lot clearer on certain aspects of it. But I think overall, financial health is so directly tied to physical health. I think I've mentioned this, the statistics earlier. If your life expectancy, the difference in life expectancy between the richest 1% and the poorest 1% of Americans is 12 years. That's 12 years lost of somebody's opportunity and chance to live the lives that they'd want to live. We know that the household wealth gap between Blacks and whites in this country is significant, and it's growing. We know that by 2053, we expect the household wealth of a Black family is going to go down to zero. By 2073, for Latinx families, going to go down to 0 at a time where those numbers going up for white communities, so for white families. So I think the direct link between financial health and health is so crystal clear in our mind. And that's why we're in this, honestly, that's why we're in this business as well with you and others, to help us figure out what's the right way to support our members and our communities in this space.
So the title of this session was After the Pandemic, and I think you pointed out that the reality is that we're still very much in response mode to a first wave, and we're continuing to see increases in over half of our states. But that said, what do you think the greatest lessons are going to be from this moment, and where do you see, what's it going to take really to achieve your vision for the, being the precision community health and achieving health equity, and to ensure that we're able to tackle some of these really intractable problems?
Yeah. So I think 3 lessons I'd want to lift up here in the last couple of minutes that we have together from what we're learning from this pandemic. And to your point, we're still in the midst of the pandemic. Just a reminder for everybody who's here, please use masks. Please avoid going into places if you don't absolutely have to do that. Keep your social distancing. All those are really important parts of our tools, if you want, to help us suppress this pandemic. But 3 key, I think, lessons for me. 1, this is the time to let our public health leaders lead. This is not time for politics. We need to double down on the importance of letting the public health leaders in this country and in the world lead. So that's a key message. The second takeaway, I think, for me is, the pandemic is not just a public health crisis. It's also a financial crisis, and we have to think about how we balance the response to both. I think I've seen over the last few weeks, and particularly a big push to try to put these as opposing each other, and the reality is they're not. Like, we need to figure out how we're bringing the public health community, the financial community, to work together to help us recover from this pandemic that's crisis on both fronts. And then the last piece, I think, to me, is the most critical piece. I think we've seen the disproportionate impact of this pandemic on people of color in our communities and across the country. And as we're thinking about the recovery, we have to be thinking about how that recovery is done in an equitable way. We want to make sure that we're supporting people who are mostly impacted by the pandemic at all different levels, and lifting them up so we can have an equitable recovery. Because if we don't do that, we're going to get at the other end of this pandemic with a more inequitable community, more inequity, and further away from social justice. And I'm hoping that this is the time that it's an inflection time to get us all moving towards equity, towards social justice. And I'm hoping that everybody will be in this together.
Me too. Dr. Choucair, thank you so much for joining us today and for your vision and your leadership. We look forward to continuing the partnership with you and your team to write what I hope is like the next chapter of your book on how we can really work collaboratively to address the financial health challenges of your members and in our communities as a way to ultimately improve health outcomes. So for those in the audience, please watch for the info about where to get Bechara's book, and we would love to hear from you. So thank you so much. Have a great day.
Thanks, Sarah.